Good day, everyone. I'm Dr. Hank Wu, Medical Director of the Cardiac Rehab Program at the Miriam Hospital. Today, we're going to talk about symptoms of acute coronary syndrome. First of all, we will talk about what causes cardiac chest pain or angina. Cardiac chest pain or angina is caused by a mismatch between the oxygen demand for the heart and the oxygen supply to the heart. What determines the oxygen demand for the heart? Well, blood pressure, heart rate determines the demand for oxygen in the heart. So for example, if your blood pressure is high or your heart rate goes up because of stress or because of exertion, it increases oxygen demand to the heart. On the other hand, rest or stress relief lowers the oxygen demand for the heart. What determines the oxygen supply for the heart? The oxygen supply of the heart is determined by the blood supply or the coronary arteries that delivers the oxygen to the heart. Therefore, when there are blockages to the heart arteries, there will be a decrease in the oxygen supply to the heart. The first question you might ask is, how do I know that the pain that I feel in my chest is angina? Angina would have three characteristics. Number one, angina increases with exercise or stress because of increased oxygen demand, or will increase or is triggered by cold temperatures due to narrowing of the arteries that can sometimes be induced by cold temperature. Number two, angina pain usually is decreased or relieved by rest or relaxation of nitroglycerin because it lowers cardiac oxygen demand. Number three, the heart is not a very sensitive organ. Therefore, angina symptoms should last at least a few minutes and not seconds. A typical angina pain is usually pressure-like, a squeeze or a tightness, is poorly localizable, and sometimes can present also like a burning sensation. It's unusual to feel like a stab or a lightning-like pinch. The angina pain can often go to the jaw, to the neck and shoulders, usually the left shoulder, and even down the arm. So, is my chest pain cardiac or is it angina? The pain is likely to be angina when it meets all three of the characteristics we talked about. It's 50-50 or intermediate when it only meets two out of the three. It's very unlikely to be cardiac when it only meets one or none of those characteristics we talked about. However, if the cardiac chest pain lasts more than 10 minutes and does not go away with rest or nitroglycerin, call 911. So what is acute coronary syndrome? Acute coronary syndrome happens when the cardiac chest pain does not go away within 10 to 20 minutes, despite stress relief, rest, and nitroglycerin. When it lasts that long, it could become a heart attack. So what are the presentations of acute coronary syndrome? The acute coronary syndrome can present as what we call unstable angina, when despite the chest pain from the heart, there is no damage suffered by the heart. The acute coronary syndrome can also become acute myocardial infarction or heart attack when there's damage to the heart. Either way, when there's acute coronary syndrome, it's considered an emergency and needs hospital care. So please call 911. What causes acute coronary syndrome? Our coronary arteries can be lined up with plaque that are made of cholesterol throughout the years. And those cholesterol plaques lines the arteries. They can grow with time and then breaks off. When that plaque breaks, our body interprets it as a bleeding is happening and therefore try to stop the bleeding by triggering the clot formation inside the artery. That clot formation can close the artery and block it completely, causing a severe mismatch of supply-demand and heart attack. Pieces of the plaque can also shower downstream and occlude the arteries, causing, again, a supply-demand mismatch. When the supply-demand mismatch is short duration, it causes cardiac ischemia without cell loss. When the duration of the supply-demand mismatch is prolonged, cell loss occurs, and that's what we call a heart attack. Here we show a cartoon of a cholesterol plaque inside an artery inside our heart. Plaques are formed because of chronic exposure to cholesterol. Over time, if not properly managed, the plaques can get bigger, and then the bigger they get, the more chances they get to break. There are many reasons for the plaque to break. Sometimes it's because of high blood pressure. Sometimes because there's too much fat inside the cholesterol plaque. When that happens, clotting system gets activated and try to seal the plaque. However, our body usually overreacts and blocks the artery with that clot completely or almost completely. When that happens, it causes a severe mismatch of the supply and demand of blood in the heart, cutting the oxygen supply to the muscle, causing cardiac ischemia or heart attack. In this cartoon, you can see that the artery that is supplying the anterior portion of the heart has a plaque that is rupturing and a clot is being formed. The clot is blocking almost completely the blood supply to that area of the muscle of the heart, causing a significant damage or heart attack. What is unstable angina? Unstable angina is a type of acute coronary syndrome where the heart's demand for oxygen exceeds that of the supply. It happens usually suddenly when the plaque ruptures and the clot is forming. If we can avoid the clot from blocking the artery completely and avoid prolonged ischemia to the heart cells, we can prevent cell loss, and therefore we can prevent a damage to the heart without causing a heart attack. In this case, the cardiac enzymes, which is called troponins, would remain normal, which means there is no cardiac cell loss. What is a heart attack? The other name for heart attack is acute myocardial infarction. A heart attack is a type of acute coronary syndrome where the heart's demand for oxygen exceeds the supply, usually because the supply is very little or is being cut off because of the blockage of the arteries. It means that the cardiac ischemia has been happening for a while, usually 20 minutes or longer, and heart damage has happened. In this case, cardiac enzymes or troponins are elevated because of the loss of cardiac cells. And that is why when you have a chest pain that lasts more than 10 minutes, please do not wait. Let the doctors and the hospital take care of you. Please call 911 so we can prevent cell loss from your heart. When you arrive at the hospital with chest pain, one of the first things that we do is to do an EKG, which is a measurement of the electrical activity in your heart. That also helps us distinguish the type of heart attack you're having. It helps us determine whether the type of heart attack is an NSTEMI, which means non-ST elevation myocardial infarction, or a STEMI, which is a ST segment elevation myocardial infarction. In NSTEMI, the EKG did not show an ST segment elevation. In STEMI, the EKG showed ST segment elevation. In terms of treatment, patients with STEMI usually requires immediate cardiac cath lab activation and opening of the artery to save the heart from cell loss. In summary, please make sure you understand your presentation of angina or cardiac chest pain. Remember what makes a chest pain more likely to be cardiac. When angina does not go away after 10 minutes, it becomes an acute coronary syndrome. An acute coronary syndrome is a medical emergency, and you have to call 911. Do not wait to call your doctor and wait for a response to report on the symptoms. If the pain does not go in 10 to 15 minutes, please call 911.